So this right here looks like a bird's head. This is the coracoid process, and this is the anterior view of the scapula. And this right here is the subscapular fossa. Right here, oh, this right here. And this is the lateral border. This is the medial border. This is the superior border. And this inside here, right here, this is the glenoid cavity or the glenoid fossa. Okay, so now we're going to turn it around. This is the posterior view. This right here is the spine. This right here is the acromion, right here, and it articulates with the acromial end of the clavicle. And below the spine, right here, this is the infraspinous fossa, and above the spine, right here, this is the supraspinous fossa.
And how can you tell left from right with the scapula?
You could tell left from right because the spine is always going to be on the posterior side, and the glenoid cavity is going to be facing out because it articulates with the humerus. So
what side is the scapula?
So this is the left scapula.
Okay.
Ready? Okay. So this is the clavicle. This is the sternal end. It's a little bit thicker and more flat. And this is the acromial end right here.
What end articulates with the scapula?
So the acromial end of the clavicle articulates with the acromion of the scapula.
Okay.
Okay, so this thing sticking out right here, this is called the xiphoid process right here. This right here is the body of the sternum. And this portion right here is the manubrium. And this notch right here is called the jugular notch. And these two notches right here are called the clavicular notches. And they articulate with the sternal end of the clavicles. And right here, these right here are the costal cartilage notches right here. And these are the costal cartilages. So this is the humerus. It is the left arm.
How can you tell left from right?
You could tell because the head is always facing inside, articulating with the scapula, the glenoid cavity. And you could also tell because these three things right here, the trochlea and the capitulum, you could tell that this is the anterior view because of these three things right here. So this is the head. This right here, this part right here is the anatomical neck. And this right here is the greater tubercle. And this lower to that is the lesser tubercle. And you also have right here is the deltoid tuberosity. Right here. This is the deltoid tuberosity, and you could tell because it's always going to be on the opposite end to the head of the humerus. So if the head is inside, the deltoid tuberosity is going to be on the outside. Now if you go down here, this part right here, inside right here, that is the coronoid fossa. The coronoid fossa is always going to be anterior. That's the coronoid fossa. This is the medial epicondyle, and this is the lateral epicondyle. Now, the capitulum right here articulates with the radius, and if you turn it around, this is the olecranon fossa, and this part right here articulates with the ulna. And yeah, this is the olecranon fossa.
Okay, and then we're gonna do the rib.
Oh yeah, the rib. So this is the rib.
How can you tell left from right, or can you even tell?
You could tell left from right because you want to look. Hold on. Yeah, you want to look for the costal groove. And oh yeah, the costal groove is right here. Costal groove is right there. To tell left from right, the costal groove is going to be on the bottom. So just lay it flat, and the costal groove has to be facing the bottom. And then the tubercle, which is right here. So this is the head, and this part right here is the tubercle, and this is the neck. The tubercle is always going to be on the posterior side. So the costal groove is going to be on the bottom, and the tubercle, which is right here, is always going to be facing posterior. So this is the front of the rib, this is the back of the rib, and costal groove is down here somewhere. So this is going to be the left side of the rib because the head is towards the back and the costal groove is towards the bottom. So yeah, this is the head, this is the neck, this is the tubercle, and the costal groove is right here. That's the tibia, and this narrow bone here is the fibula. And for the tibia, the lateral condyle is right here, over here on this side, and the medial condyle is over here on this side, and the intercondylar eminence is this right here. This part right here is the intercondylar eminence. And
This is the tibial tuberosity. And then this part right here is the medial malleolus. And on the fibula, you'll see the lateral malleolus. And then this is the head of the fibula. And it goes like this. They go together.
go.
This whole part is going to be the coxa. The coxa is divided into 3 separate parts. This top part right here is the ilium. And this is going to be the iliac fossa in here. It's an indentation. Then up here is the iliac crest. And then this is going to be the anterior superior iliac spine. This is the anterior inferior iliac spine. And back here is the posterior superior iliac spine. And right here is the posterior inferior iliac spine. And right below that is a greater sciatic notch. And if we come down here, this is going to be the ischium. So right here is the lesser sciatic notch. That's part of the ischium. And then the ischial spine is going to be this little part right here. This is the ischial tuberosity. And this before right here is the obturator foramen. Then right here is the pubis. Right here is the pubic body. And then right here is the superior pubic ramus. Then this is the inferior pubic ramus. Right here in the middle is the pubic symphysis. The pubic symphysis is made out of baleen cartilage. Then right here is the acetabulum. The acetabulum is where the head of the femur sits. And then right here in the back back of this. Let's see. You can see it. It's the auricular surface. The auricular surface is gonna articulate with this bone. And then you can tell male from female.
Go.
So this is the femur. Right here is the head of the femur. And this is the neck of the femur right here. And this is the greater trochanter. This is the lesser trochanter. This line right here, like this indentation, is the linea aspera. And then right here, you're gonna find the medial condyle, lateral condyle, intercondylar fossa. And if you turn it right here, this is gonna be the patellar surface. This is where the patella would go. The patella is right here. This is the patella. This pointy part right here is the apex of the patella. This is the base, and this is going to be the anterior view. If you turn it around, that's the posterior view. This side is going to be the medial facet, and this part right here, where the E is the lateral facet. And the patella would sit right here on the femur. So this is the foot. This is going to be a right foot, and you can tell by looking at the big toe. This part right here is the calcaneus. This is the talus. This bone right here is the navicular. This right here is the lateral cuneiform. This is the intermediate cuneiform. This is the medial cuneiform. And this is the cuboid. Looks like a cube. And that's going to be the foot.
Alright, so you have the hand right here. These small bones are the carpals. They all have names. So starting here, you have the scaphoid, the lunate, the triquetral, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. And there's a little acronym to kind of remember all that, and it's some lovers try positions that they can't handle. And then up here you have the metacarpals, starting with 1, 2, 3, 4, and 5. And then towards the end you have the phalanges. So the thumb only has 2, which is the proximal and the distal, but the other ones have a proximal, middle, and distal phalange. And it goes 1, 2, 3, 4, 5. And so you know that it is the left because the thumb is always going to, in standard anatomical position, is going to sit on the outside. So the thumb being on the outside makes it the left, and also the sesamoid bones are always going to be on the anterior surface. So you have the radius, you have the proximal, so the top head of the radius, you have the neck of the radius, you have the radial tuberosity right here, down at the end where the ulna sits, you have the ulnar notch, and then you have the styloid process. So you know this is the left because the styloid process here is where the thumb is, and it's always going to be lateral away from the body. Alright, this is Russell Greenwald, and we are looking at the ulna right now. Up top up here, we have the olecranon process. This side, you have the coronoid process. Inside, you have the trochlear notch, where the articulation happens. You have the radial notch over here, where the radius sits. And then down at the end, this little piece right there, you have the styloid process. So this is where the pinky is going to be, and it's always going to be medial, which is towards the body, so that's how you know it's the left.